You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants, according to my first guest, and we've had him on the program before. He says nobody should be wearing a loose-fitting denture. With us, we have Dr. Devin Hall. Dr. Hall, welcome to the program.
Randy, thank you very much. I'm glad to be back here on the show. We've got some exciting things to talk about today.
Now, you have a lot of photos, so we'll get to as many of those. And you work with Dr. Jackson.
Yes, Dr. Jackson and I work together. He's fantastic.
We've had you both on the show, I think, for the last few years or more.
Yes.
And so do you see a lot of people that now have teeth because of them seeing you on the program?
Yes, Randy, we have people come in all the time, every day, because they have watched our shows, they've seen us talk about what we can do to improve lives, change lives, using dental implants to replace teeth, give people a new set of teeth. And they come in every day, and we're able to see them. They watch the show, and they come to see us, and we can take care of them.
Now, you have this new concept. You call it Teeth Tomorrow.
Teeth Tomorrow.
What is it?
So Teeth Tomorrow, dental problems today end with Teeth Tomorrow. So Teeth Tomorrow is a new treatment that we're offering here in our office here in Bowling Green. And it is, you come in for surgery one day, you get teeth taken out, you get the implants placed. The next day you come back in, and we can put a set of teeth, a new set of teeth in your mouth that you cannot get in and out.
Is that right?
We can take it in and out, but the patient cannot.
You call it Teeth Tomorrow.
And that's called Teeth Tomorrow. Surgery one day, you come back, get your teeth the next day, Teeth Tomorrow. And they do not come in and out. We can get them in and out, but you cannot.
Now, you guys are a major dental implant center. We should mention, and I also want to mention, I'm not siding with you. I'm just asking the questions today. I'm not trying to endorse you, but you have something pretty special, I guess, going on there, where the typical way it's done is you go to two different places, or three. One place that does the surgery, another place that puts the teeth on top, and another place with the imaging. You do it all right there. Now, aside from convenience, what's the benefit to the patient?
Oh, the benefit, they get to come to one office. They get to work with one doctor, or maybe both of us, both Dr. Jackson and myself. They can come in, we can take the imaging, the CT scan in our office. We're not having to send them to an imaging center. We can do the surgery in our office for the implant surgery, and they come to our office for the final teeth. And so everything is in one place. They're not having to go here and there and work with multiple appointments with our office and then with these other offices. And then we are there for the entire process. We know exactly 100% what is going on with this patient.
Okay.
And what their case is, and what their specific needs are for their case, and for what their treatment is going to be entailing. So we have total control over the entire process because we can do it all in office.
So what's changed? What's new since last time you were on the program?
Materials have changed, and that's where this Teeth Tomorrow is coming into play. We have new materials that are backed by science, backed by studies. We know they work. We know that they are durable. They're way more durable than what the materials we've previously been using are. They're virtually unbreakable, and that's backed up by studies.
Yeah, you're using the zirconia
It's
teeth.
called Protal zirconia, and it is pretty. I mean, it is a beautiful material. It's called Protal, yeah, but it is pretty. I mean, it is as lifelike, as natural of a material as we can have to replace a full arch of teeth, and it's beautiful. And the teeth look more natural. They look more lifelike. They look more vibrant. The gums look more natural. They can be just painted on like a paintbrush. They're artists up at the lab where they make them. We've been up there.
Okay.
It's an unbelievable facility, and the technicians up there are fantastic. So that is an advance that we've had since I've last been on the show.
Plus, you're big on teeth that don't snap in, snap out. Just giving people teeth that are theirs.
And these are teeth that they go in, we put them in, and the patient cannot remove it. And so to the patient, it feels more natural. It feels like a third set of teeth. They're not having to think about a denture that comes in and out or snaps in and out. They go in there. We screw the teeth in there, in the end of the implants, and they're beautiful.
And these people are getting IV sedation most of the time. Is that right? So
most of the time, yes. Both Dr. Jackson and I have been doing IV sedation for some time now, and it's great. We love it, and patients love it. So it is not uncommon for us to have patients come or drive an hour, hour and a half away to come to our office.
They come an hour and a half away to do this?
Yes, to come in for IV sedation.
Okay.
And so many of these people have not been to the dentist for 20, 30 years. It's incredible. And they have been putting off treatment. They just haven't wanted to go see a dentist because of fear. Bad experiences as a child, or just painful experiences while in the chair. They hear that we do IV sedation, they come to us. It's fantastic. We're monitoring them the whole time. It's safe. The patients relax. Their blood pressure lowers most of the time during the procedure. But we're monitoring heart rate, blood pressure, their breathing, keeping them safe, keeping them comfortable.
Is it true they have some people have like no memory?
Yes.
Or very little memory of the procedure?
Most of the time, if the patient remembers anything at all, it might be walking into the office. Beyond that, they typically have no memory, which is what they want. So many of these patients, like I said, are fearful and they're scared to death. It's hard to get them to even walk into the office.
Is that right?
And we're able to sedate them, and then after the treatment, they don't remember the treatment. They don't have a memory of it. They don't want to remember surgery. They don't want to remember, getting their teeth out or whatever procedure we're doing that day. They don't want to have that memory of us in there working on them. And so having the IV sedation that causes that amnesia effect, where they have no memory of it, is great. They love it.
Now, with this teeth tomorrow concept, somebody could come in on one day, extract their teeth, put in the implants. The next day they get their teeth.
Exactly.
That happens.
That happens. Yes, that happens.
Rare, or it's common in your practice?
No, this is
like
a
what you guys
procedure
do.
that this is going to become the gold standard for tooth replacement, for full tooth replacement, as far as treatments are concerned. There's no doubt about it. Dentures should go away.
You don't like dentures?
Don't like dentures because they're not attached to anything.
Okay.
Why? Dentures have been around for centuries, right? Why would we still be making them the same way now as we were
Good point.
50, 60, 70 years ago? We have implants now. We can attach a denture. We can attach full sets of teeth to implants to where they either snap in and they're secure and patients can eat whatever they want, or we can put them in and they're fixed in there and they feel like their own teeth.
Okay.
And they don't come in and out. We have advanced beyond regular dentures.
So what do the patients, so the patients come in, what do they like more? Do they like the way it looks, their new teeth, or the way it works? That means they could eat and chew whatever they want.
They like both. When it comes down to it, they like both. And they may come in and they're initially looking for a better smile. Maybe they're wanting to smile more. They're wanting to have a more cosmetic smile. They want to look like, the people in the magazines or people on TV. But then they realize, you know what, I can eat an apple, or I can eat corn on the cob. And they're not only just happy with the way their teeth look and the way their smile looks, but they're happy with what they can eat. I had a patient, he's in a fixed full set of teeth, okay? And when he started out in our office, he had a removable denture, came in and out. He now has a fixed set of teeth that he cannot take in and out.
Okay.
And he told me the other day, he said, I'm eating apples, biting into them with my front teeth. I'm eating corn on the cob. If I could survive on eating steak every meal, I would. So he said, before I had a denture, I could gnaw on a steak. You put it on the scale of 10. He said, my steak eating was about a 3 out of 10. He said, now it's a 10 out of 10. He's ordering the T-bone, he's ordering the ribeye. And loving it.
So, I was talking to Dr. Jackson, your partner. He said that it's mostly women that are doing this, like 70% women.
So
or
that's
is it more men, or men put things off? I mean,
it seems like men tend to put things off a little bit, and they adapt. They try to just get by with what they have, with what they've gotten used to. But it doesn't have to be that way. This guy, he came to us. He's got his own business. He's in construction. He's young. He was way too young to be in a denture. Okay, but any age is too young to be in a denture, but he was definitely way too young to be in a denture. And he's out and he's got his own business. He's needing to talk to people and speak to people and converse and grow his business. And he was concerned about what everybody thought when he was talking to him. He felt like they were looking at his teeth the whole time, or looking at his denture the whole time. He told me his confidence level, by changing nothing else, his confidence level by getting a fixed set of teeth went from a 5 to a 9 by changing nothing else, just his teeth. He loves where he's at. He loves his smile. He loves what he's able to eat. You know, I always thought, you know, that people with dentures, they could eat, you know, before I knew better, that they could eat just about anything.
Yeah, because
That's
I know a couple of denture wearers. They've never complained to me.
Right. And they're not going, you know, with you, they'll probably try to hide it, right? So they don't want to publicize the fact that they have a denture, right?
Okay.
Many times, so they kind of want to hide it. But he told me when he went to a restaurant to eat, and he looked at a menu.
Yeah.
It wasn't, what am I in the mood for today? You know, what do I want to eat for lunch today? His first thought every time when he was looking at a menu, what can I physically chew? What can I actually chew on this menu? And bread. He even said bread got on his nerves trying to eat it because it would stick to the roof of the denture. It would stick to the palate of the denture because it covered the roof
Or
of
like
his
a
mouth.
sandwich pulling things.
A sandwich pulling it out, you know, that would come out. Couldn't eat, you know, apples and corn on the cob. And so he would go to a restaurant. He would have to order what he could physically chew, not what he was in the mood for. And then when you get it, so the even worse, you finally get this food. You may not even be in the mood to eat it, but then you can't taste it because the roof of your mouth's covered with the denture.
That's what they tell you.
That's what and he's told me that. And so much of taste comes from the roof of our mouth, and when the denture covers the roof of the mouth, it takes away the taste. And so he's in a fixed full set of teeth now. His taste is 100% back. He can eat anything he wants. He even told me he's eating beef jerky. Beef jerky.
Is that right?
So he's eating the steaks, he's eating the beef jerky, he's eating the corn on the cob and apples.
And this goes for everyone.
This goes for everybody.
He's
not special in this. You know, this is
you
what
see
we
this
can
every
do.
week. You see this every week.
This is what we see every week. Yeah, this is modern dentistry. What we can do, we can advance beyond the dentures that come in and out that aren't attached to anything. We can upgrade them into something that will allow them to eat what they want to eat, be able to smile the way they want to smile. How about whistling? He wanted to go outside, whistle his dog. You know, whistle to his dog, come in.
Well,
he couldn't whistle with the denture. Now he can. He can whistle. And you know, the incredible thing with him is, and he's not alone in this respect. He had the surgery, we placed the implants, and the pain that he described, he said it got to say about a 2 out of 10 is the most his pain level got.
Going through the process.
Going through the process.
Okay.
Going through the process and the surgeries. You know, so many people, they hear, you know, I'm needing dental implants or I'm needing oral surgery, and immediately they go on, you know, how much pain am I going to be in after? And he's telling me he was at a 2 out of 10, which is incredible after that kind of a surgery, after that kind of a procedure. Now everybody is a little bit different.
Yeah,
but,
yeah.
I mean, every week people come in and they have these kind of procedures done, and we're seeing them, you know, the next day after the surgery, and they have maybe taken one pain pill. You know, they're really not in excruciating pain, which is amazing. Many times they have been in so much pain with their teeth, with their natural teeth.
Yeah.
And just getting those teeth that have been hurting them so bad out of there eliminates much of the pain that they've been dealing with.
Now, the denture wear. Are there a lot of denture wearers? I mean, you guys haven't wiped out the denture population.
We
where
have
you are.
not wiped
There's
out
still tens of thousands.
Yes, thousands and tens of thousands of denture wearers and people that are heading towards a denture in our area.
Okay.
So people, if you're wearing a denture now or you feel like you're going that way, you're not alone. There are a lot of people around that are in your same situation.
We've talked about this before, that the denture wearers adapt. That means they don't go to the dentist anymore. So it's tough to get them in. But they're like the ideal person, right?
Yes, because
if you could get them.
If we can get them in, and that's why we're doing this. We need to educate people, because if you're in a denture, you've been through a lifetime of tooth pain, of treatments, coming to the dentist, in and out of the office, paying money here and there, and you've been, you know, you feel like you're just throwing money at your teeth, but things may never get better, things may never get to where you're happy with them, and even though, you know, you may have gotten your teeth fixed, then you still don't like the way they look, you don't like the appearance of them, you still feel like you can't smile, and they feel like they have just, you know, nickel and dimed and spent all this money along the way, and they've still had pain, and they've still had reasons that they've not been happy with their teeth and their smile, and so they get their teeth out and they get into a denture, they're relieved. They can relax. They don't have to go. They don't have to. The money's
done.
done. They don't have to come to the dentist anymore. No more visits. But what happens is they're out of the dental marketplace. They don't know what's available
They don't know
to
their
them.
options.
They don't know their options.
They don't know that they could have teeth tomorrow.
Exactly. They don't know they can have teeth tomorrow. They don't know they can.
That's a slogan. I mean, it takes a few visits, but
Yes.
you could do the implants on one day and give them their teeth the very next day.
Give them teeth
That's
the very next
tomorrow.
day. That is teeth tomorrow. That is teeth tomorrow. And they stay in. They're not coming in and out. They feel like your natural teeth. Had a patient, he said, with his fixed set of teeth, he doesn't even think about his teeth now.
Yeah.
Most denture wearers, they're constantly thinking about their teeth. What can I eat? What can I chew? Does this look like a denture? Are people going to notice that this is a denture?
Whatever.
I've got to clean it. If I'm at a restaurant and I get food up underneath it, well, now what do? I got to go to the bathroom and be at the sink and cleaning them out, and that can be embarrassing if someone walks into the bathroom right at the same time. It's what they are adapting to.
You're
their
excited
lifestyle.
about this, by the way. Almost more excited than the other interview I did with you a few years ago.
I am, because I've seen the improvement and I've heard what this is doing to people's lives, what they're able to do now with this set of teeth compared to what
Now
they
we
had
have to
before.
mention though, Medicare, Medicaid doesn't cover this. Even the best dental insurance doesn't cover this.
You're right about that, but we have options. We have options for financing that we work with, companies that work with us for dental treatment.
Because you don't carry this yourself.
Exactly.
So you have to have
we work
decent credit,
with
you can
third
get this
party,
done.
yes, with third party financing and lenders, and we work with these companies daily.
Okay.
And
Are
we're
people
able to
financing it?
People are
all the
yes,
time?
financing it all the time, the time, and we have people, members of our team that help patients get financed to be able to
do this.
fit these treatments into their budget.
All right.
And so even though insurances and things like that don't necessarily cover much of this treatment, there are ways around it. We can work with it, and we can get the patient into a nice set of teeth that they can be happy with.
Now, you have some photos.
Have some photos, yes, of some patients we've treated.
Okay.
This lady, she came into our office, and I want to preface this. I want to talk about the importance of a smile here. So she came in and she didn't smile. She didn't feel good about herself. She was lacking her self-confidence. Okay, so she came in. She was also in pain. So not necessarily, she had some tooth pain, but she also had more like jaw joint related TMJ pain, neck pain, things like that she was dealing with. She came to us, and we first of all, I was very excited. She's a great patient, and I knew that we could really help her out. And these are her teeth that we've just worked on. She is more of a cosmetic case.
Wow!
But we improved her smile, and just what do you think about that? What do you think the before and after? Just looking,
she looks definitely a little younger.
Yes.
It's more attractive.
Yes.
More sophisticated.
Just look at her eyes. Her eyes she's just screaming happiness here in this photo, in this after photo. It is, this is just a gorgeous case. The smile communicates so much to people. And the smile can make people feel better. It will lift emotions. It works as a natural antidepressant, a natural painkiller. We know this now. Science is telling us it actually causes, release of endorphins and things like that to lift
So you
spirits.
look at it as you're giving people their smile back.
This can be yes.
And by giving them their smile back, their life changes.
Their life changes. Yeah, they let their inner joy come out then, because they're not hiding anything. They're not being held back by their smile. We're able to give them a great looking smile, and she comes in, and I mean, she's taking photos with the staff, and she's with our team members, and putting them on Facebook and writing reviews on Facebook for us. We don't even ask. She's just doing it. She is so happy, and her husband is a great patient now. For years he was just fearful, and he wouldn't come to the dentist. But after her experience, his fear and level of anxiety about coming into the dentist, he's coming in now. He's a great patient. So it's fun seeing these changes and what dental treatment can do for patients. So Randy, this patient came into our office. She had problems. She had pain. She couldn't eat. She couldn't work with the teeth that she had. Our option was to get rid of her natural teeth and look into doing a couple options. We can do denture.
Okay.
which
you don't like dentures.
Yeah, we don't like dentures. You know,
right.
so she opted. We got some teeth that can snap in and out, that she can really smile better with, eat better with, and you can see in the before and after here. The before, you know, she wasn't smiling really big. She was restraining her smile. She was, you know, she just doesn't look as energetic, as youthful. The after, she's bigger
so
smile.
So it's a full arch of teeth that are just locked in.
It's a full arch of teeth, yes, and she can lock them into the implants, and you know, she comes into the office, she's making jokes and she's cracking people up, and she just has a big time now. Her personality is showing through.
Okay.
Whereas before it was restrained. She has kids, she loves, you know, and family and doing, you know, being active with her family, and she's not being held back by her teeth now, and she's letting that inner joy come through. She's letting her true personality shine. She's a joy. This patient, we have, she came in with a denture, and we knew, it's like, we can make this better. We can make her smile better. We can really make it look youthful and do a really good cosmetic upgrade on her case and make her really shine through with her smile. Really pleased with how that turned out. And even this, you can see before and after. That's her old denture in and new denture in, and the difference is pretty striking.
So this is like a cosmetic denture.
This is like a cosmetic denture.
So some people,
yes.
they can't afford like the implants. You can move them toward that direction?
We can move them toward that direction. If, you know, let's say we maybe have to start her out in a good cosmetic denture. She can be smiling, really improve her smile. Mm-hmm. At some point, she may want to do some implants and get it to attach onto the implants, and by all means, we can do that, and we can upgrade her along the way as she is ready. This patient came in, and she's a joy. She works at a local healthcare center around you know, in Bowling Green, and so she's seeing people, she's greeting people as they walk in the door, and really just a joy. So she comes into our office, and this is normal for our area. So.
Okay.
We have issues, you know, if they come into our office and we have gum disease issues, which is rampant in our area. We have teeth that are loose and teeth that are hurting, teeth that are decayed and just have big cavities. We can't save them. So these are common cases for our area. So with her, we decided to take
no more traditional denture.
No more traditional denture, and get her into a set of teeth that locks into some implants, and she's doing great.
Looks good.
She is just a great lady and tons of fun. She was a lot of fun to work with, and always a joy to come into the office. And she is so happy now that she has her new set of teeth. This patient, he came into our office with a mouthful of bad teeth, loose teeth.
That's pretty bad. That's got to be unusual.
This is not unusual at all. So, and I'll tell you why, because there are people walking around, hundreds, thousands of people walking around with teeth that look like his. But you don't know. You don't see it because they're not smiling. They're walking around. They never smile. They're walking around, and people may perceive they're angry or they're not friendly or they're just having a bad day. But when it comes down to it, he is a happy guy. He just didn't want it to show through with his smile. He couldn't smile. So
he couldn't save those teeth.
He could not save those teeth. I mean, they were loose. They were, they were essentially falling out of his head. In his after, you can see him smiling real big.
Different guy.
He is a happy guy, and he loves smiling. And this is a new set of teeth that he has here. And it's letting his personality shine through, and he's no longer having to deal with these bad teeth and the gum disease and things that he was having to deal with before. That's all gone. Got him in a new set of teeth, and you can see the result. He's a happy guy. He's loving to smile now.
So, this Teeth Tomorrow concept, for people just tuning in, what is it?
So, Teeth Tomorrow, dental problems today end with teeth tomorrow. So we may have a patient that comes in and they have a lot of bad teeth or gum disease, they have a lot of pain, and it's time to get them out of their teeth. Okay, it's time to get rid of their teeth. Can't save their teeth. There's nothing we can do. So we're past saving teeth at this point. So they can come in and they can have surgery one day. We can get the teeth out. We can put the implants in, place the implants, and they go home that night, rest. They come back in the next day, and we can screw in, we can attach a new set of teeth that does not come in and out on that patient. We can take it in and out, but that patient cannot take it in and out.
So that's the Teeth Tomorrow. I mean,
Teeth Tomorrow.
So that's a big change for you.
It's a big change. It's a big change.
Because you were only doing snap in, snap out before.
Right.
Now they're fixed.
They're fixed.
Well, that's what everybody wants, right?
Yes,
Teeth that don't come out at all.
Exactly. So even, we've done a lot of snap-in teeth that come in and out that the patient can take in and out, and they're great, and they get great results with them, and they can eat and smile and have fun and all those good things, be active with them, and not have to worry about those teeth coming in and out. Think about an old denture way back when, and they were always having to worry about the denture moving or coming out, things like that. Snap in, snap out, they're not worried about that. But we have a new procedure, a new teeth tomorrow that we can offer the patients when they come in, that the teeth stay in there. They stay in their mouth. They can't take them in and out.
You just brush them.
And they brush
like
them. They brush them.
teeth.
They clean them just like their natural teeth. They come in and we take, we clean them essentially like natural teeth.
They look real?
They look beautiful. And this is a big upgrade in the materials. The ability of these teeth that stay in now. We can do these materials that are far different than what a traditional denture or even a snap-in denture is made out of. And this is a much more lifelike, much more natural looking, vibrant material with teeth that look beautiful, gums that look natural, and with the teeth not being able to come in and out, they're going to feel great to the patient. They're not even going to think about them being in there.
So don't put it off.
Don't put it off.
You say that you have people that saw you on the interview, on TV, and they've watched it a bunch of times, and they come in and they're still skeptical. You say they still say,
Yes.
"Are you sure, doctor?
Are you sure we can do this, or I can do this,
They say that.
or I have enough bone to work with, or any number of questions that they come in with.
So
and
they're
they
still
watch the
skeptical.
show, and they're still, they can still be a little skeptical. We get them in for a consult. We get to meet them and get to know them a little bit, and at the end of it, they're ready to go. They're excited, and they're looking forward to being just like these patients, getting rid of their old teeth that we can't save anymore, giving them a new set of teeth that is going to
no more
look
dentures.
great. No more dentures.
Do you think
no
you
more
can wipe
dentures.
out dentures in your town someday?
That would be a dream. We could walk out, just wipe out dentures, no more dentures, that everything is attached to some implants.
If these denture wearers knew how good it was, and you say there's thousands in your area, if they knew how good it was, there's probably not even enough dentists to service the people.
Right.
To do this, is that right?
Yes. If they knew how great it was, it would be no problem to just totally book your schedule based on these needs and these patients to get their, to get a third set of teeth here that's attached to some implants.
Okay, good. Well, I want to thank you for coming to the show.
Well,
Always
thank you,
a
Randy.
pleasure. Good stuff.
Enjoyed it. Thank you again, and always a pleasure coming on the show.
Good. They could go to the website, look at the photos,
Yes,
things
go to
like
the website, look at our photos, chandlerparkdentalcare.com.
Is it true they could even talk to some of your patients?
Yes. We've had patients that would, definitely be willing to speak to prospective patients about their experience in our office and,
How easy it can be
and how good the result can be.
All right, thanks again. Good
Thank
job.
you.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.